It is the fact that India represents the highest number of leprosy cases worldwide. It is also the fact that leprosy is completely curable disease. Hi, I am Dr. Major Rajiv Gupta, consultant internal medicine, Max Hospital, Mohali. So today we are going to discuss about leprosy. Leprosy is also known as Hansen disease. Leprosy is caused by Mycobacterium leprae. Peculiarity of Mycobacterium leprae is that it cannot grow artificially. Leprosy is completely curable infectious disease. Leprosy mainly affects the skin and peripheral nerve and leads to deformity of the affected part. Leprosy mainly affects the colder part of our body like earlobe, nose, hand, feet and testicles and leads to deformity of the affected part. Leprosy mainly transmitted by droplet method and it requires prolonged contact with untreated patient. Now we will talk about how leprosy transmitted to the human beings. Bacteria are transmitted via droplets from nose and mouth of infected persons to a healthy individuals. Beside humans, 3 other species can transmit leprosy to humans. These species include chimpanzee, manga bear monkeys and 9-banded armadillos. Let's talk about who are more prone to get leprosy. The person who is living in endemic area definitely more prone to get leprosy. If we talk about male and female ratio, male are more prone to get leprosy as compared to female, where this ratio stand 1:2. Leprosy is more common at the age group of 10 to 20 years. Now it's time to talk about sign and symptom of leprosy. Incubation period of leprosy is very long. So definitely sign and symptoms are also occur slowly. The first symptom which patient experience is loss of sensation or numbness of body part. As the disease progress, patient may experience complete loss of touch, pain and temperature. Long-term symptoms are quite bothersome. Patient experience painless ulcer, hypopigmented patch or macules, facial disfiguration. Some patient experience loss of digit. How do we diagnose leprosy? First and foremost is the history of the patient, whether patient belongs to endemic area or if he has any contact with leprosy infected person. Other available diagnostic procedures are skin smear, nasal smear, skin biopsy, nerve biopsy and lepromin test. In skin and nasal smear, we isolate Mycobacterium leprae from the respective secretion. In skin biopsy or nerve biopsy, we take sample from the affected nerve. Now let's talk about the treatment of leprosy. Leprosy is very well curable disease. Leprosy treatment is simple and the drugs are supplied free of cost in government hospitals. Regime definitely is decided by the treating physician. Combination of drug known as multi-drug therapy or MDT is used to treat leprosy. As we discussed, leprosy affects the peripheral nerve and skin, so most of the bothersome complication belongs to nerve and skin. Apart from these, eyes and bone are also get affected. Peripheral nerve damage leads to hyposthesia, anesthesia, muscle paralysis and lack of sweating. Ulnar nerve damage lead to claw hand. Radial nerve damage leads to wrist drop and popliteal nerve damage leads to foot drop. Eye complication includes corneal sensation impairment, keratitis, conjunctivitis and corneal ulcer. So these are the major complications which leprosy patient experience during the course of illness. So how do we prevent and control leprosy? People who live in the same household need to be examined by a physician on regular basis. These examinations should be repeated annually for 5 years. Unfortunately, there is no vaccine available for prevention of leprosy. So please don't miss your checkup and default on medication, as only this can help in prevention. In the end, I appeal to you that please avoid the stigma surrounding leprosy. It is a curable disease and can be managed well with multi-drug therapy. So let's come together and eradicate leprosy from India. Thank you.